guys, so we're filming just to kind of help each other out in doing well in this comp, but I'm going to explain how to layer the hot packs and what that looks like. So I'm just going to use this guy. So a lot of people have had trouble with figuring out how many layers, and it can be tricky. So just to kind of go over, if the hot pack is here and you put it in this sleeve, this counts as 1. If you fold this over, this is 2, so then that would be 2, 3. So again, 1, and then this counts as 2, so 2, 3 layers would be, where you have that. And if we had towels, so 2, 3, we want 6 to 8 layers, so this is already 3. And then this can be 4, 5, because you're folding it in half. And then, again, 6, 7 would be like that, and this can count as 8 if you just folded it like this. It might look confusing, but you just really want to be mindful, mostly with these, when you're considering which side you're using to put on the client. So this would be 8 layers put on the client.
Perfect. On the shoulder. Good job.
On the shoulder, yeah.
Yes.
Okay, next I want to talk about sizing. There are 3 different hot pack sizes. This is the humongous size. It usually goes on the back. Probably would only use, so Chris said that he will have us apply packs to the neck, the shoulder, the arm, the elbow, the hand, the wrist, but not the back. And so like, if he has a shoulder injury or needs a hot pack on the shoulder, we'd probably use that big one, but you don't have to. We also have these, oh my gosh, this is so hard to get out. The neck sizes, these are mainly for the neck. You could also use it maybe if it's a little, I don't know, did he say on the wrist? You could use that on the wrist because it's small enough and wrap it. And then we have the medium size that she just showed you with the layers. So there's 3 sizes. So the medium size is good probably for the elbow, for the wrist. Chris did say use the big one, the biggest one for the hand to cover so that the whole hand is covered. And then on the cold ones, it's pretty much the same sizes. Here's the neck one, or just a long thin one. We've got this medium size one, and I don't know what these are. Really just these 2 sizes. Oh, sorry, this is the big one, the biggest size, and then this medium size, like this. And since I've already got the ice pack, putting it in the pillowcase, it's just 1 layer. We don't want to do multiple layers in the pillowcase, but it's important to put it in. I found, like, if you see the size of this rectangle, if you match the pillowcase orientation with the ice pack orientation, and so I'm going to put it in like this, and I'll show you why. Because if you put it in like this, you won't be able to wrap it. So you kind of put it in as the same orientation as the pillowcase. Because, like, say he has a wrist fracture or whatever, you need to put it on the wrist. It needs to wrap all the way around, and then you have this excess pillowcase so that you can wrap it underneath and get it a good, tight wrap. Whereas if you wrapped it, if you put the ice pack in the other way, the ice pack wouldn't be able to roll over your arm and then wrap it the pillowcase. I don't know if that makes sense, but it just doesn't work. I'll show you what he showed us for the hand. We need to put the ice pack in the hand. Or heat pack. You want to make sure that they cover the whole hand. And so I'm going to use the biggest pack that they have. So it gets like all the fingers and all the places. It just has more coverage and it covers the whole hand. But you're going to want to wrap that really tight and make sure that it is completely covered like that. Same with the heat pack. And if we're going to do like the elbow, we could probably use this biggest one. It would probably be enough. He'd be sitting at the table. And you would, again, wrap it around all the way. Same with the heat pack. Wrap it around all the way and you'd be sitting on the table and it would be like tight on the skin. Some other things that we learned, make sure that you check his actual skin, which I thought was really kind of
Invasive.
especially on Chris. But yes, we're gonna have to like check the skin before we put on the pack and get a visual check, make sure, touch the skin to make sure that they can feel sensation. And then at the 1 minute mark, again, you know, I don't know if you remove the pack all the way or just like remove it enough so you can see how the skin is doing. Do you have anything to add to that, Ariana? Okay.
Just add.
I'll be quiet.
Sweet. So I'll have you take off your jacket, please.
Okay.
If they had a jacket on, have them take it off. Probably. Or it counts as a layer.
Well, first, actually, you want to just go through the whole thing, like the audio of like, hi.
Oh, yeah. All right. So, hello, Heidi.
Hi.
How are you doing?
I'm good. How are you?
Good. I'm Ariana from Occupational Therapy. We're going to be doing some heat on your shoulder today.
Okay.
And before we begin, do you have to go through the contraindications?
Yes.
Okay.
Yes,
Before
go
we
through
begin,
contraindications here. Closer. Okay.
Before we begin, I do want to ask you what's going to seem like an exhaustive list of yes or no questions, okay? Just to make sure that you're safe and also that we can proceed with this specific form of treatment.
Okay.
So, do you have good feeling in your skin?
Yes.
Okay. Do you have any infections?
No.
Any swelling?
Nope.
Any inflammation?
Nope.
Any pore thermal irregularities?
Nope.
Any tuberculosis?
No.
Rheumatoid arthritis?
No.
Cancer or tumors?
No.
Multiple sclerosis?
No.
Any bleeding conditions?
No.
Any blood clots?
No.
Any cognitive impairments?
No.
Okay, that means...
Advanced heart conditions?
Yeah, any heart problems?
No.
Okay. Well, that means we're safe to continue with this treatment. Thank you for that.
So what does this help with?
Yeah, so with hot packs, it's going to help decrease pain as well as help you produce more movement in the shoulder. So right now it might seem limited, but after we place this heat, it's just going to help you have more what's called range of motion, so more movement in that shoulder.
And then you might want to check to see, make sure I don't have any insane skin.
Yeah. Okay. Are you able to pull down your shirt
Yes.
just so I can check your shoulder and make sure everything looks good? Do you mind if I touch you?
You go ahead.
Okay. Do you feel that?
Yes, I do.
What about that?
Yep.
Okay, great.
Okay.
Now we can open.
Okay.
So I'm going to secure this right on your shoulder. It's going to be hot, but we don't want it to be burning. So that's what the neck is gonna
Yeah,
be.
it's like
It's so big.
it's like on my
Yeah.
But I can lean over.
Yeah. So we want it to be hot but not burning.
Okay.
You let me know. If it's too hot, we can add more layers.
Okay.
If it's not hot enough, we can also remove layers.
Okay.
Cool. Just so you're comfortable. Talk with me. Let me know.
Right.
Okay. So
How long do I have to hold this on me?
I would recommend you probably not holding it.
Oh.
I can.
Yeah.
Yeah, because it can be hot on this hand.
Yeah.
Well, I was wondering how.
So we
We can secure it with this sheet right here. What I'm gonna do is put it on like a toga.
Okay.
And you can, if you want to lift that hand, what I can do is just.
I can just put my arm down like that. That's good. Here.
Okay.
I'll show you.
So this is probably better than them like
Yeah.
having to hold it. Maybe it's also your preference.
Well, they're not supposed to hold it.
Yeah.
Chris was like, if it can be draped without being held, that's okay.
Yeah.
But I kind of like the using a big sheet as a toga
Yeah.
thing for the shoulder.
Yeah, because remember, if they were
It's okay.
if they were to hold this top part, there's
They'll
only
burn.
1 or 2 layers of sheet in between their hand and the hot
Yes.
pack, so that can cause burns. All right.
So how long do I keep this on here?
So I'm gonna check it in 1 minute,
Okay.
just to make sure everything looks good. 1 minute has passed.
Okay.
Okay, let me
And
go
check
ahead
it.
and check the skin. Do you mind if I pull your
Go
shirt
ahead. Yeah.
over?
That's
Okay.
fine.
Okay, so it is going to be red, but it doesn't look like any abnormal redness.
Okay.
So that means we're good to continue for another 5 more minutes.
And how long total do I have to keep it on?
Total, it would be 20 minutes.
Okay.
For the hot plate.
Yes. Yes. 20
So,
minutes.
yeah, and I'll be checking it every 5 minutes for a total of 20 minutes.
Okay.
Okay,
Sounds good.
just to ensure that the skin looks good.
Yeah. And then how does this relate to my occupation?
Yeah, so what have you been struggling with?
Well, I've been
when-
having a hard time reaching my bowls in my cabinet. I keep them on the very top shelf, and
Just
it
'cause
really
it-
hurts.
Because it feels stiff and in pain?
Yes.
Okay. Yeah, so what this is doing is just heating up those muscles, almost like a warm-up. Did you ever play sports?
Oh yeah.
Yeah, so it's like you had to do warm-ups
Mhm.
before engaging in sports so you don't pull a muscle or anything like that.
Right.
So this is helping us warm up those muscles to help you have more mobility in your
Okay.
shoulder, which after we heat your shoulder, we can do reaching in the
I
cabinets
see.
because we have some bowls here that we can work on.
Okay.
Just because you're probably going to have more range of motion and then less pain
I see.
and less swelling.
Okay. Great.
Yeah, so we'd want to.
Very satisfied with my survey with your abilities as an OTA.
Oh, thanks. Okay, and then
All right.
20 minutes
That's the
have
end.
passed. Blah, blah, blah.
Okay. Next, we're gonna do cold pack.
Come in.
Hi. I don't know why I'm not. I'm Heidi. I'm your OTA. I'm your OT practitioner. And today I heard we're going to be placing a cold pack on your hand. Is that correct?
That's what they told me.
Or actually, let's place it on your elbow.
Okay. Awesome. Yeah.
Yeah. So that's. Do you have some pain in your elbow?
I do. And you can see it's kind of inflamed right now, too.
Oh yeah, I can see the inflammation.
Yeah.
What is it keeping you from doing? Like, what do you normally do that you can't do right now?
Driving is hard.
Okay.
Like driving here was painful.
Right.
Having to get that elbow into extension because of all of the inflammation was hard.
Right. That's
Um,
good.
and picking up my child, yeah.
Yeah, I bet. So the cold pack is going to help with. Hold on, I got this. The cold pack is going to help with decreased pain, decreased muscle spasms, decreased edema and inflammation. So we're going to go ahead and get that cold pack ready. I'll be right back.
Okay.
Oh, I can ask for contraindications.
Yeah.
So I'm going to go over contraindications with you for cold pack. Do you have any open wounds, infections, or regenerating nerves?
No.
Do you have any cold hypersensitivity or intolerance that causes welts, Raynaud's disease, or poor circulation? Sounds like you're a great candidate. I see your skin. Do you mind if I touch you?
No.
Just see. Okay, sorry, that probably hurts. Okay, I'm choosing the big one for her elbow, the biggest one, because I feel like I want to make sure that it wraps all the way around her elbow. And again, I'm going to place it in the pillowcase in the same direction, like the same shape as ice pack, if that makes sense. So that it can wrap easier. So, all right, go ahead and put your arm up there. Let me know if I missed anything. Okay, go ahead and put your arm on it. So as we do this, Ariana, you're gonna feel cold, and then it's gonna be burning feeling, and then achy, and then it will go numb. And then there's a reason we call it cryotherapy. My God.
I love that.
We're gonna keep this on only for 10 to 15 minutes. And when you reach the cold or the numb part, that's when it really starts working. So if you can brave through these painful parts, we'll get to the part where it starts to help your inflammation go away. I'm going to check your skin at 1 minute, and then every 5 minutes until 15 minutes is up. Okay, I'm not going to torture you with that.
I know, poor Chris and Caitlin.
I know. So after you are driving, after you've driven, you can, or do whatever things that maybe make it more painful, you can place an ice pack on it and to help the pain and swelling go away. But you don't want to leave it on for more than 20 minutes at a time, because then the opposite effects might start happening, where it starts to be painful again. And we don't want that to happen. So don't leave it on for more than 20 minutes at a time. And then in between, you don't have to say this in the comp, I don't think, but in between you can let your body heat back up, wait 30 minutes or more, and then you can apply the ice pack again.
Okay.
Any questions?
No.
Great. So Hannah's putting on a neck one, and she was gonna have the client hold the neck thing on because it wasn't gonna stay, but we can't have the client hold the neck thing because it would burn them. And so here's her idea, and I think it's great.
So funny.
Wrap the hot pack in the sleeve first, not the towel.
Yes.
Good job. Don't put the hot pack in the towels first.
Should we show
You
what
put
we're
it in
talking
the
about?
sleeve.
In this part.
Yes.
In here.
Number 1
Not here.
in the sleeve.
Did I
Okay.
place that
And
in
then
there
wrap the
correctly?
towels, right?
Also cover the sleeve with a towel, because it says commercial cover must not be in direct contact with the patient.
Okay. Because we don't want to get the patient's dirty
Yeah. And then
skin on that commercial thing right
Yes. And
there.
then
Sleeve.
the way I placed it in here, is this correct? Do you guys know?
I think so.
Yeah,
That's good.
That's good.
Looks good.
Even though this part isn't the part that's up on their neck.
Yeah, I don't think it matters.
Because like when I look at that shape, I always imagine like this is like the top of it. This is their head, and it goes like this.
I don't think he ever
He never
said
specified,
which
yeah.
way, so
Yeah,
we're
I would do
gonna
it that way. Okay.
do it whatever.